Bowel obstruction. It's drop the diagnosis. We're checking the plumbing from the stomach to the stasis. Listen up closer to restriction of the flow. Intestinal contents with nowhere to go. Divided in two, is it paralytic or mechanical? Classify the onset, keep you thinking botanical. Acute is rapid, chronic is slow and insidious. Acute on chronic, that lumen's getting hideous. A narrow pipe suddenly hits a total block. When the content's getting spissated, it's a system shock. There's a cardinal four you gotta memorize. Colicky, pain and distension in their eyes. Absolute constipation, no flatus, no stool. Vomiting follows, that's the clinical rule. Look for the scars, check the laparoscopic ports. Search for the hernias, ignore the false reports. Is it simple or strangulating? Check the blood supply. If the fossils are compromised, the tissue's gonna die. Think of a tube, classify the cause by the site. In the lumen in the wall or outside, get it right. Lumen food bowl is gallstones or a parasite. Interception or fecal impaction in the night wall. Chromers or retration from the start. Outside adhesions, bands in the vulval is part. Internal or external, the hernias will twist. If you don't find the cause, then you failed the whole list. Cause the cardinal four you gotta memorize. Colicky, pain and distension in their eyes. Absolute constipation, no flatus, no stool. Vomiting follows, that's the clinical rule. They pull the scars, check the laparoscopic ports. Set for the hernias, ignore the false reports. Is it simple or strangulating? Check the blood supply. If the vessels are compromised, the tissue's gonna die. Neonates, atresia, Hirschsprungs, and the elis of meconium. Infants, meckles, intussusception, hernia, pandemonium. Young adults, adhesions, and the Crohn's disease. Flare, elderly, carcinoma, and diverticulitis are there. Don't forget the bolus or the fecal mass. Age tells the story of why they can't pass.